absolutely. Okay.
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 Much easier.
You treating two people today?
I have to show different parts of the body. Nobody has the same body.
How
We
long?
did it. I think we did it. We did it last time too. Okay. I showed you some of the stuff on the bottom of the structure. Yeah, come on up here. Yeah, I'll go to the other side. Trisha is an excellent swimmer. So where's Trisha going to pull her body apart? She's going to do it at the top. Carolyn's a tennis player. Where will she do it? She'll do it any place she can.
Everywhere.
Everywhere. But the tennis player, don't forget, really pounds that concrete when they move. No matter how good your tennis shoes are, your bones are going to take a beating. Okay. One of the things I found most fascinating that Ida Rolf said is that the head and the neck are a single unit. They are not separate. Weird, huh? Everything from the head winds up in the neck or the fascia surrounding the neck. So if she has a problem, can you see here that this collarbone runs higher than this one? Can you see the difference, that this is higher than that? Nobody's going to stand in front of the mirror every day and say, oh, my collarbone's out of place. No. The miracle is we function at the very highest level anyway. We're designed to take a lot of, blips here and there. So, okay. So let's talk about giving Trisha some release in her neck because she was swimming so hard for so long. Now, how many sides does the neck have? Okay, you can turn this up here towards me. Yeah, how many sides does the neck have? Why would you just work the front and the back of the neck? That doesn't make sense, right? You got to get into the side muscles of the neck. Okay, so you get to lie on your side. Face the wall. All right. I don't want her bones to be squashed together there. So as a result, I'm going to give her a little bit of a lift of the pillow. That's where all these outfits are making all this money with these cervical pillows. Or you can just get rolled. Okay, there we go. So bring your arm over your ear. Whoa, can you see here how much more of a pull she had? Bring your arm down. Watch the way this works here. You see how much this material goes forward. What hooks up here underneath her pec minors? Those scalenes. The scalenes are off the neck. Using a bunch of weights at a gym is nuts because you don't know which layers you're actually opening and which you're actually tightening. So the hands will tell you though. So when you're talking about a neck, you start down here at the waist and you're going through the serrati because you cannot have an even front and back unless the sides are on the side. If this goes like this, how the heck can she suspend the back and the front properly? Now, I'm not knocking massage. I'm saying that's fine, but know what you're getting. I'm not knocking anybody else's modality. The fact is, if you want to cover yourself with peanut butter and feel better, and you do, I'm all for it. Perfectly okay. Your mind is that powerful. This is mechanical. Okay. Now, I noticed that her rib is about rib 8 here. Okay. Bring your elbow down at right angle slowly. How can I get into those scalenes? God, they're under the pec minor. Well, let's think. Bring your arm up, Trisha, and turn your nose to the sheet. Now, where do you feel the pull? Trisha.
Down here.
Yeah, where do you feel the pull now?
Up here.
Right, I'm up here. I'm going for the scalenes. She's helping me by bringing her elbow down. The scalenes hook up on a couple different ribs. Remember, they come up from behind the ear. Okay, bring your nose to the ceiling. I'm feeling movement in her armpit as she turns her head. Elbow down, turn your nose to the sheet. Watch the movement to create the release. Up. Notice there's multiple parts moving. I think that's why Tai Chi is so right on too. You're moving multiple parts with each set, with each stance. And down.
And the breathing also feels good.
Yeah, she's just commented her breathing is clear. Up. Okay. Now remember, this is a girl who was swimming. She had a very, very hard time turning her head when she came many, many, many years ago. And up. Interesting way to clean out a neck, huh? Okay. Now I'm going to get up above her head, Carolyn, and
I have a feeling they might be at 11:15.
Okay. So we're talking sideline. Well, the sideline is going like here, right up into her temporalis and through her triceps. So let's check the triceps and see how that might be part of her neck fascia. Triceps are real sneaky little buggers.
So Tricia, does this hurt?
No, it feels great. That's why I'm here.
But it's
I
deep
needed this.
tissue, right? It's deep.
You know, it's intense, but it doesn't hurt.
Got it.
No, it's intense because you feel it all through I can feel it all through my legs.
Through your legs.
Again, there we go. Yay, Chinese medicine.
You guys have questions?
Each national group, go ahead, each national group seemed to have a modality of some sort that could get in far deeper to the bone than just a massage. Relative to the question, does it hurt? For what it's worth, I am already booked through 2024 all the way with clients that have been coming for 20, 30, 40 years. Again, I think it's sort of like a local joke. I think they love how they look at their class reunions. Okay, again, following through the sideline here, which means how many layers are in here? Anybody?
Many.
How many muscle layers?
Many.
6. So I want to get all of them. I can't just get them going with one direction. So how do I get into the bulk of the layers? I ask the client to move. Say a secret is they're Rolfing themselves. Okay, turn that nose to the sheet. Turn the nose to the ceiling. Nose to the sheet. Nose to the ceiling. This is all just to get into her neck. There you go.
How
Those
long
to the
do
sheet.
treatments usually take?
It really depends on the rolfer. On the mainland, they love the 55-minute hour. I don't think you can do diddly squat in 55 minutes. The minimum I work is an hour and a half. And I want that person feeling good when they walk out. So if something is undone or doesn't feel quite right, I ask them. I want to know. Okay, right here she's tight. Turn your nose to the sheet. So in Hawaii, my sessions will go an hour and a half minimum. Doris Resch will do a 2-hour session, but she will also give instructions on posture and all of this other stuff. It just depends on the rough. Call them, ask. Look them up on the computer and ask how long their sessions are. The session should be as long as the person needs to get an area cleared out. Nose to the ceiling, Trish. Now, notice how far she's turning. She's almost at a complete right angle here. You see the relationship here. So it's pretty good for someone who couldn't turn her head when she walked in. Not today, but initially that's why she keeps.
A little bit, just thinking about how stiff you feel.
Oh, I love it because as she works for me, I can move it further and further. And then it goes deeper and deeper, which just feels better and better. So when you guys leave, I'm going to keep getting Rolfing.
Good deal. Do any insurances cover this?
Are you kidding me?
Yeah, okay, I kind
No,
of was.
of course not. No, it makes too much sense. Lie on your back, Tricia. Now I want to show you how we're going to get the rest of this moving. Yeah. No, insurance doesn't cover this.
So how much does it cost then?
I charge $182. I will probably go up to $191 in January. I haven't changed my prices for 3 years. I guess it's okay now. Doris charges $230. No, she charges $210. She might charge more. Other roofers charge varying amounts, but it's all, you're talking close to a $200 layout per session. But you're going to get your value. You're going to get your money's worth. Okay, turn toward me, Tricia. Notice the opposite turn here. This is where these scalenes come in. Scalenes are the buggers with neck problems. Everybody looks at the front and back of the neck. That's not where it is. Come on. Come back to the center. Oi. She's been carrying babies. I could feel it here.
So I went to
And,
Mary-
you know, people would coming back for 20 or 40 years because it hurts. Be serious. Okay.
So I went to Marianne once and I said, my shoulder really hurts. I've had physical therapy, stem cell therapy, and it hasn't gotten any better. And I didn't do anything unusual. I used to swim. I used to play water polo. So I've had tendinitis. And I don't know what she did, but she did like this and it went away.
Hey,
Yeah, I don't even remember.
Kelly was in a very serious accident whereby her, in getting out of a boat, her starfish pattern was basically obliterated. In other words, the pulls between the 5 appendages of her body were pulled unequally. She saved her life, but as a result, the parts never quite went back into place. So I had to go through. I found a lot of her problem in her left elbow. Okay, come back to the center and turn.
And then interesting.
But I got to show.
Go ahead.
So the point is you really respect your client. You really listen to them. They will give you the clues all the way along. Notice who's turning at right angles.
I do like how you can see so much more flexibility from the beginning to the end. Just
Oh,
of this
yeah.
10 minutes.
What, don't even, you want that. That's why you walk in here. You don't get it, don't come back. Don't go to anybody a second time if you don't get what you need.
So I had left elbow pain, and I realize now after talking to Marianne, you can stretch your elbow all different ways, but if, and they're actually, online you can get these foam, they're not rollers, they're rubberized things in different sizes, and they have you grab one part with one hand and one part with the other hand, and you rotate them, and it goes through many layers of muscles when you move it like that. And so now I get this pain, not from playing tennis, from like walking the dog or something because it's pulling, or even from doing yoga from having pressure on here. And I can just go like this with no, I'm not holding anything, and go like this, and it really helps it. It goes away.
Okay, raise your chin a tiny bit. That's it. I noticed that she was a little tighter up here by Atlas and Axis, so I had her raise her chin in order to get the compensatory folds even. There's a lot of architecture in this too, you know.
And so if you think about
So the
all
longer I
different
work, the
layers,
less I know. Pardon?
Oh, I was just saying, if you think about all the different layers of muscles and how sometimes we just think about one muscle in isolation, but Marianne's thinking about
Yeah.
all the different levels and how to get them all moving, and she promotes adequate hydration, which we see with everybody as they age. Hydration is so important. Just drinking water, of course, and then keeping the muscles hydrated enough so that they can actually move and aren't stuck to each other.
So Kelly, it's not just the muscles, it's also the material, the space between the muscle and the bone.
And the
The
fascia.
space in the joint, yeah, that's all maintained by fascia. Fascia is becoming a big thing, these days. We were at it about 100 years ago, but anyway, if you wait long enough, the truth comes up. I want to show you this really neat move to get into the anterior ligament on her spine. If you go over there, Carol, come sit on the side. So she's probably sit.
Okay, oh yeah, like this one. Yeah,
Yeah. This is a really, really, really good move to access the ligaments on the front of the spine that you can't get to unless you stick your hand down someone's throat, which I certainly wouldn't do. Okay, push your feet into the ground. Make sure that there. Turn your head right. Turn your head left. Good. Right. This is how you get into the side of the neck. Keep turning. Especially you get, watch this atlas access. Remember that your spine goes up behind your nose. This goes way the hell up into the skull. Okay.
Sorry.
Out the window. Top right here. Okay, center. Now here's the nifty part. I bet you've never seen this before. Okay, drop your chin down. Plant those feet, straight knees straight in front, like an Egyptian, like those old Egyptian statues. Okay, drop your head forward. Make sure you get this, Carolyn, here, what I'm doing to the back. Notice she's moving right along with me. It's not a one-way street here. And I think Rolfing people, the people who stay with it, they feel really good. Oh, that's great. A bone just moved here, whatever, Rich. Atta girl. Turn right.
Other questions?
Where are you feeling it?
down my left back.
Okay. What's your question?
I don't see any questions. This has been wonderful.
Okay. Turn. You're still releasing the neck from in between the shoulder blades. Come on down. Keep bending toward me. Turn right.
And I'm so
Oh, yeah.
jealous.
Can you feel
Tricia
this?
gets more Rolfing.
Yeah. Well, she's getting her neck adjusted,
Yes.
believe it or not, right before your eyes.
Her neck in her back.
Okay. Right.
So I've been seeing Marianne for 25 years.
Ah.
And this is only the second time she's done this. So Marianne's always learning and adapting and changing, and this feels so good.
So before you send me a halo, the reason I had to figure out this move is I broke my arm. And normally I would go down the back. I would jump up on the table and go down the back with the person just dropping forward. Then I discovered, quite by accident, because I don't know if you can see, can you see this wrist? My right wrist is thicker than my left. It doesn't look the same.
Yes.
That's the arm that was, I broke both bones. So I had to figure out how I could get the power from my arm into the person's body, and it dawned me, oh, here it is. This is a much better move than just going down the back, because they are participating much more, and I'm not breaking my arm a second time. So even an injury sounds awful. I'm not a preacher, But an injury can be a blessing. I hate to say that.
So
It just
something,
sounds so hokey.
something good can come out of something bad.
Well, or else it's a kick in the butt to try new moves. I don't know if there's something bad or it was just a way for me to, come on, keep thinking.
Well, thank you
Don't
so
stop
much.
now.
We're going to go to Dr. Sakai now.
Good,
With
we're
thought
done.
field therapy. Thank
Okay.
you so much, all three of you, for helping film and everything. And,
Yeah, love it.
yeah.
Yeah, no.
Ooh.
You gonna
Take a
take a
look at
bow? Oh, yeah. All right, thank you, guys. Have a great day and Happy New Year.